Hello class, my name is Trisha Miller and today I'm going to be talking about holism. Holism is the core value that has been identified for the Nursing 324 course. Holism means that the nurse has to consider everything about the patient that they are treating. This takes into account that the patient is a unique individual with their own set of beliefs. Each patient has different experiences growing up in their own unique environment, and this has influenced them and shaped them. Holistic nursing involves the mind, body, and spirit. Nurses need to explore how religious, social, and cultural beliefs affect their care. What are the patient's beliefs about health and illness? Each individual is different. Holism impacts nursing care in many ways. To be a holistic nurse, you have to consider mind, body, and spirit when taking care of patients. For example, the doctor places an order for a Foley catheter to be inserted in your patient because of urinary retention. As far as body, this is going to help the patient and relieve the urinary retention. This is the way that most nurses think. As a profession, nurses do not always think beyond this. Sometimes nurses can just be task-oriented. To apply holism, the nurse would need to think about how the insertion of the Foley catheter affects the patient emotionally. Is the patient embarrassed or scared? Is a male nurse going to insert the catheter into a female patient? Some cultures would not allow a female to have a male nurse do this. The nurse should also think about the spirit. Does the patient need to see their religious leader or pray or meditate before the procedure? The impact that holism has on nursing is extensive. It changes the way that we practice. Instead of being task-oriented, nurses have to think about the whole person when treating and interacting with patients. Holistic care requires more time and better communication with your patients. The nurse would need to ask questions about how the patient feels about the procedure. There is actually a certification also that nurses can get for holistic nursing. An example of trying to provide holistic care that I have recently experienced involved a husband and wife. COVID-19, of course, has at times completely eliminated visitation except for end-of-life and birth situations. I had a male patient that experienced extreme anxiety and discomfort from being away from his wife. They had been married many, many years and had never been apart. His anxiety over this was so severe that it was affecting his care. I arranged for him to have a private room and got permission for his wife to stay with him. His treatment was much better from this point on. In this situation, I had to consider the patient's mind and spirit and not just his body. This is just one example of using holism. There are many opportunities to apply holism when caring for patients. Holism is the consideration of mind, body, and spirit of a patient and has a definite impact on nursing. This core value makes nurses focus on more than just tasks that they need to perform. Nurses need to also consider how the orders that they are going to execute affect the patient emotionally, spiritually, and physically. Nurses should also think about how a diagnosis may impact the patient. This way of nursing may take a little extra time, but in the long run, it will increase patient satisfaction with her care. Thank you for your time. Bye.